Thank you so much for watching On Call for All Kids. Today we're talking about top tips for new parents. We'll discuss why your baby is crying and how to soothe him or her, what causes jaundice and when to be concerned, and the importance of meeting vaccine timelines in baby's first year of life. I am joined by Dr. Jennifer Arnold. She is both a neonatologist and the medical director for the Simulation Center here at Johns Hopkins All Children's Hospital. So happy to see you, Dr. Arnold. How are you?
I'm doing really well. Thank you, Ashley. It's great to see you too. You know me, I love to talk about babies, whether they're robot babies or real babies.
Well, me too. And this is a great topic, especially for new parents. It can be an overwhelming time, a little bit scary. You have this new life you're caring for. So I'm glad we can kind of talk about those top tips for them to think about as they're going through this new journey of parenthood. Let's first talk about crying. I mean, why do babies cry, and how do we know if it's possibly colic or something like that?
Yeah, crying is something that obviously every baby does, but it can be challenging for parents to manage, especially sleep deprived parents, right, in that newborn period. And we really worry about crying when it's excessive. And then we start to think about, could this be colic? And colic, really, the definition of colic is when crying happens for no apparent reasons, but it lasts greater than 3 hours a day for more than 3 days a week in an otherwise healthy infant less than 3 months of age. In general, crying, it does increase in the frequency and the amount up until about 6 to 8 weeks of life. But if a baby develops that true definition of colic, which is that excessive crying, 90% of babies will have that resolved by the time they're 8 to 9 weeks of age. So again, it's not fun to go through for parents, but know that it will end.
How do we soothe ourselves as parents? Because you've said it's very important to take care of yourself and also soothe a baby during this time when they're crying.
Yes. So, first thing I think is important is to talk to your pediatrician because they can do a physical exam and talk you through it to make sure there is no, concerning reason for the excessive crying. And once they determine that your baby is just healthy and that this is likely colic, management of those symptoms is key. And so some of the things you can do first and foremost as a parent is take care of yourself. Have a buddy that you can hand off the baby to when you get overwhelmed because you've got a lot going on as a new parent and you're not getting enough sleep typically, although I hope you are. And so those are, the times that you need to have a buddy so that you don't become overwhelmed. But to help your baby through that colicky time, things you can do, you've heard the very common recommendation to take your baby on a car ride. Sometimes that works. You may not be able to do that, particularly if you're recovering from a C-section. So there's a lot of things you can do in the home that are safe. A white noise machine is one thing that sometimes helps some of our babies. Other things, baby massage. So there's a lot of online resources to help you learn how to do infant massage, and that might help. And then, just sort of anything like rocking your baby, kind of taking a walk around the neighborhood. Some of those things help. Unfortunately, there's no cure, but know that it will get better.
It does improve. That card trick always worked for my kids. So another thing, jaundice, that orange yellow color that we sometimes see on babies. When do we need to be concerned about that?
Yes, that's a really important question because jaundice is something that is very, very common. Happens to almost all babies, but it can be scary, and it's something that can have consequences if the jaundice gets too extreme and is not monitored. So, what jaundice is? It's actually a change in the skin color caused by something named bilirubin, and bilirubin is actually something that all of our red blood cells in our body make, normally. But when you're an adult like us, your liver breaks down that bilirubin into something that you can get rid of in your pee and poop. Babies, unfortunately, their liver is not quite typically as mature as it should be. And so, as you can imagine, premature babies actually have a higher risk of jaundice. And so that bilirubin that's made naturally has a harder time being excreted out in the urine and your poop. So we monitor babies to make sure that the level of the bilirubin doesn't get too high because at high levels, it can actually cause neurologic problems. And we call that bilirubin-induced neurologic dysfunction. And so the important thing is to monitor your baby. If your baby starts looking yellow color, that jaundice appearance, it usually starts at the head and works its way down the body, because as that bilirubin accumulates in the body, it actually goes to your skin. And that's why you get yellow first. And then it gets more and more into the bloodstream, and then at high levels can affect the brain. So talk to your pediatrician if your baby starts looking jaundiced at any point.
So, Dr. Arnold, are there any ways that you can prevent jaundice from happening?
In general, it's hard to prevent it, although the more your baby feeds, breastfeeds, poops and pees, that actually helps to get rid of that bilirubin. The other thing, obviously a little bit of exposure, safe exposure to sunlight, because the sunlight can actually help turn that bilirubin in the skin into something that you can excrete. It kind of does the work of the liver. But in general, because we just don't know always how to prevent it, and we never know which babies are going to be at higher risk, all babies should be screened before leaving the hospital to check their bilirubin level to see if they're already showing signs of being at risk. And then, of course, once you go home, if you see a sign of jaundice or your baby starting to turn yellow, you do want to see your pediatrician so that they can test your baby for that level and see if it's high enough to warrant treatment.
Lastly, let's talk vaccines because in that first year of life, they get a lot of shots. Sometimes it's almost more painful for the parents to watch it. It's like, oh, I don't want to see my baby cry, but they do well with it. Talk about the importance of sticking to those timelines and getting those vaccines in the first year of life.
Yes, vaccines are so important. They save lives, and our babies, they are still developing their immune system, and they are most vulnerable to some very high risk and life-threatening infections. And so we actually know that all babies have a schedule of vaccines recommended, one at birth, and then the majority are given at 2-month intervals after that, 2 months, 4 months, 6 months, so that we can really protect our babies from those life-threatening infections. And the challenge I think many parents ask is, can I space them out? It seems overwhelming. Well, while that sounds like the right thing to do, it honestly isn't really helping to protect your baby when they're most vulnerable to these life-threatening illnesses. And so all of the vaccines have been tested to work on a schedule to be able to both provide optimal protection, and also to be able to have the baby's immune system react and build up that immunity to the best of its ability. So they're really like developmental milestones. I like to think of them, right? Your baby's, motor skills, for example, they do certain things on a timeline at birth, at 2 weeks, at 2 months, at 4 months, and the immune system is developing as well along its own trajectory. And so these vaccines are given at times when we know they'll be most effective in protecting our babies.
Well, Dr. Arnold, it is always a joy to speak with you. Thank you so much for sharing all these great tips on being a new parent. It was really helpful.
Oh, thank you so much. Good luck to all the parents out there.
Exactly. Congratulations if you're a new parent watching. And thank you all for watching today. Don't forget, you can also check out our website. It's hopkinsallchildrens.org/newsroom. And there you'll find a lot of other timely topics in pediatric healthcare and other great resources for your family as well. We will see you next week.